bell for the end of the school day may have rung, but the learning doesn't end there. This is your quick geography revision session. We're covering Year 9, Module 3, Health and Wealth. I'm Mr. S, and I'll be your quick revision tutor. Health and wealth is about how money can influence and change our health. Richer people, for example, tend to live for longer than poorer people. Less developed countries are more likely to suffer from infectious diseases, while more developed countries have issues linked to lifestyle choices like diabetes. As always, we have 5 elements to look at, so let's start with 9.3.1 HIV. HIV is a communicable disease. That means that it has to be passed from person to person. It can only be passed by coming into contact with a contaminated bodily fluid, and there are a few ways that would happen. So HIV stands for Human Immunodeficiency Virus. And in essence, what's happening is the virus is attacking your immune system, so you are less able to fight off other diseases and infections. Let's start off with looking at where this is occurring. HIV has been a huge issue, particularly from the 90s backwards, predominantly in the 80s, was a huge issue across the world. But today, this map right here represents where most of the infection rates are coming from. So you can see there are these darker brown colours where the most infections are occurring. In Asia, that's in India, but we also have China as well as quite a high rate. In Africa, there's quite a few countries, predominantly on the eastern side or the eastern coast of the country, with an example of South Africa with a really high example there. But there are also some things that don't fit the pattern. So while Africa and Asia are examples of areas that have low-income countries, the USA, so this bit here, and that's Alaska, which is also part of the USA, has a really high rate of infection, and that's a HIC. So it doesn't always fit. There are some anomalies. And even Russia over here as well is a bit higher compared to the rest of Europe and Spain. So why is this the case? Why do some countries have a bigger issue than others? It can be due to education, if the country doesn't have enough money to put education in place, or there could be other issues like cultural factors. In the UK, you learn about things like sexual health in school. You learn about what you should and shouldn't do, or how to protect yourself. And if you're not getting that information, you might know what the risk is if you catch HIV, or even how you catch HIV. You might not have been told. So that leads to more spread. It can be due to poverty. And again, that's linked to education, because it means that some locations, some countries, you need to pay to go to school. Or you might need a huge family, a big family to work the farm. So that means that your family won't have as much money to send everybody to school. Or if they need a big family, they're not going to use contraception, which means that they're going to be more at risk from catching HIV. So contraception would be something like condoms. And poor access to healthcare. So if you're not getting healthcare, you might not get tested to see if you have HIV, so you pass it on, or you get more sick. You can't get access to the drugs you need. And while we can't cure HIV, we can reduce the risk of spread and the risk of infecting others, and allow you to lead a relatively normal life if it's caught early enough. But what are the effects? Well, we split these into social, to do with people and families, and the economy, to do with money and trade. So you can see the first two are related to social. So young people in particular are afraid to socialise. So you might not do what you would normally do as a young adult because you're feeling you might be at risk from catching the disease. But there's also the emotional impact on yourself, the person who catches it, and your family. In some cultures, there's an issue regarding the stigma. So if you've caught it, you're seen as being dirty and unclean, and people don't want to associate with you, so you become isolated. And in some cultures, it goes even further. So there are issues with misinformation, where particularly in Eastern African countries, where there's an idea going around that having sex with virgins cures you. Well, it doesn't work. That's not the case. And there's a whole host of reasons why that's a bad idea. But you imagine if that was happening, that's just going to spread that disease even further. We've got the cost of getting treated. A lot of these places are poorer countries. Being able to afford the drugs to reduce your risk or to reduce the impact most people probably wouldn't be able to afford that. So this is why these sort of areas have such a high infection rate. If you leave HIV untreated, it turns into something called AIDS, acquired immunodeficiency syndrome. This is a really, really bad form of HIV. It basically means that you have no immune system left. So even a cold will most likely kill you. So you can imagine if people have AIDS, they're not going to be able to go to work. They're not going to be able to earn a living, which also then impacts on the family, not being able to food, education and health. But it also reduces the productivity and the wealth of the country. So in areas like South Africa and India, where they've got really high infection rates, there's going to be a large population of workers that aren't working because they're too sick to do so. It also then leads to an increased death rate, more people dying, and a decreased life expectancy. People are living for less compared to previous. But how have people responded? Well, health education programs have been started by governments and charities. These are aiming to tell people what are the risks. So trying to reduce unprotected sex and sharing needles during drug use, for example. A lot of these places will also have a lower literacy rate. Not as many people will be able to read and write. So disseminating that information by written form won't reach everybody. So if you can stick it on radio and on the TV, more people are likely to get the information they need to know. Particularly in Africa, they've also distributed condoms and encouraged abstinence, which is not having sex until you're married, which is going to reduce the risk of catching it. And then there are drug therapy programs. These are really expensive drug trials, but they only really happen in richer countries such as North America and Europe, because it's too expensive for most of these low-income countries to afford. Next up is famine. And famine is when we don't have enough food for our day-to-day lives. So our body's not getting enough and it's going to impact on our health. This map is a little harder to understand, but you're basically looking for the reds and the oranges and maybe into the yellows. So the reds and the oranges tell us that they're the areas that have the highest population of undernourished, so people who aren't getting enough food. And we can see that it's mainly in Africa and Asia, and to a lesser extent there is some in South America. We've got one orange and quite a lot of yellow. And again, these are all low income countries, they're poorer countries. But why is this happening? Most of it is going to be down to climate. And this is areas that have unpredictable rainfall, so you can't grow crops regularly or consistently. It could be because you get a lot of heat and therefore it's hard to irrigate, keep the plants watered or stop them from dying. Or there might be bad soil. So maybe it's close to a desert, which means that there's not enough nutrients in the soil for crops to grow. So the population of the area is not going to have enough food. It could be down to technology. A lot of countries have developed ways of increasing their crop yield by increasing automation or by genetic engineering. If you're in a poorer country, that's going to be very hard to do because it needs a lot of money invested to achieve it. And this is all linked again to poverty. So when people have less money, they can't afford food. So the food might be available, it might be there on the shelf, you just can't afford to buy it, so your family has to go hungry. And then that leads to even more issues because it means that if you're too hungry, you might become sick and not able to work and not earn any money, and then that goes wrong in a big cycle. Again, for our effects, we've sorted them into social and economic. Malnutrition is when people don't get enough to eat the right kinds of food to stay healthy. So that's going to impact people socially, but it could also have an economic effect, meaning that people can't work. It might lead to social unrest, so that's like rioting. So everybody needs to eat, so when food supplies are low, people have to fight essentially for their survival. They might end up robbing, stealing, or they might end up campaigning or rioting against the government because something hasn't been done. On the economic side, well, there's going to be rising prices. If food is short, the food that is available is going to go up in price massively because so many people want it, but there's not much to get. And then malnutrition, as we've just discussed, can lead to economic issues because people can't work and they're not going to contribute to the economy because they're too sick. And again, there's been a whole host of ways that we've responded to this. And again, predominantly it has to be LICs. So this is the local governments and charities working to do these things. One of them is genetic modification, GM. And what they've done is they've modified the genes of certain types of crops so they can grow in worse conditions. So they might be able to get drought-resistant crops that can grow without very much water, or they can grow in poor soil, or things like wheat and rice that can grow and have lots more yield. So it means it's got more rice or more wheat or maize in a very small space of land. Some countries have donated suitable machinery and techniques like tractors so they can harvest the crops faster. Providing aid in the form of food, water and money is a temporary measure, but something that can be done. So if there's an area, let's say like Madagascar here, that is struggling, some other countries like the USA or the UK might send supplies over to help them in the short term. And then even building water pumps, so drilling down into the ground and taking the water from the ground to try and irrigate the crops. Next up is obesity. So obesity is when we are too heavy. We've got too much weight. And this can have a lot of health impacts. And this is the complete opposite of the last two in terms of where do we find it. Obesity is mainly found in North America. And again, the darker the colour, the darker the reds, the more obesity there is. So this is 30-40% of the entire population is obese in the USA. In the UK, it's between 20 and 30. And this is predominantly in the HICs, the richer countries. Although there are some exceptions, so we've got South America has a lot of obesity, and as does some places in Asia. And then we've got Australia and New Zealand, which are also HICs. But why is this? A lot of this is down to lifestyle. It occurs in HICs because most of the people living in HICs are going to have what's called disposable income or affluence. That means they've got money that they don't need to spend on bills, which means they can spend it on other things like food, junk food. The lifestyle and jobs, a lot of people have service jobs, which means they sit behind a desk, which means they're not going to be doing much exercise, which means that they're not burning off all those calories, so they're going to get fatter. And our culture, there is an expectation of food. There is an expectation of going out and drinking, particularly in the UK. And these all add to the increased calorie intake, which makes us fatter, but also a reduction in exercise. The effects of this are both social and economic again. It can lead to cardiovascular disease, so heart disease, which is going to increase your likelihood of dying, of needing surgery. It can increase your likelihood of you getting diabetes or even cancer. It also means that you are less able to work. You might not be able to do the job you once did, depending on how obese that you are. Or it might mean that you can't socialise as much. Medical care. In the UK, this is more to do with taxes and how much the government has to spend. But solving the obesity problem is a very expensive thing. Hospitals have had to adapt to cope with larger people, but also with the types of drugs and treatments that these people need. And eventually, those affected will not be able to work, and again, that's going to lower the productivity in those richer countries, meaning that the wealth of the country may go down as the obesity levels go up. And just as it was with our last ones, the increased death rate and lowered life expectancy, because more people are going to die earlier because obesity is putting a huge strain on that person's body. The responses to this, a lot of this is down to education. So health education programs are implemented. So there's examples of this in the UK, like the Eat 5 a Day and the active living campaigns that they put on to try and reduce the risk of unhealthy diets and lifestyles. They've also tried to reduce the advertising on kids' TV or around kids' TV. So there's no junk food now on kids' TV channels or when kids' TV programs are on, to try and discourage children from wanting the sugary food or that junk food. And they've even started putting traffic light systems to indicate the different risks from different types of food. So on your, if you go to the supermarket and look on the back of the packaging or on the front, it'll have different colours representing how good or how healthy is it for you. Red meaning that it's more than your recommended daily allowance. Green meaning great, have as much as you want. Next up, we have smoking. Now we all know that smoking is a really bad lifestyle choice. It has many different types of healthcare issues. But Once upon a time, it was not seen as a negative. No, in fact, doctors and dentists used to recommend smoking to keep your teeth clean and to keep your throat and your lungs healthy. Now we know this is not the case today, and it's actually a really, really bad habit. And it can lower your life expectancy, it causes cancer. But in the past, it wasn't always so. So you can see here, here's an advert for Viceroy cigarettes where they're advertising that the dentists recommend it. But it goes even worse. We were just talking about obesity and how we don't advertise fast foods and sugars on kids' TV programs. Well, how about this? This is the Flintstones. And the Flintstones used to advertise cigarettes, Winston cigarettes, and you can see an advert on the TV. And although this is still, Fred Flintstone is actually telling kids why Winston cigarettes are the best things to smoke. So this is the legacy that we have today. And when you have a look at where the most prominent smoking takes place, it's mainly now in Eastern Europe and the Middle East. Okay, these are the newly emerging economies. These are the countries that used to be poorer but are now starting to get a bit of money. And that's important as we come to in a second. The HICs, they're the ones that are mainly in green. And that's because at one point in time, they would have been a lot higher. If we had this map about 20, 30 years ago, they would have probably been red. But we've put a lot of these responses in place, and the risk or the amount of people smoking has rapidly reduced over the last 20 years. But the reason why NICs are the biggest smokers today is largely due to the fact that people in these countries are starting to get a bit more money, which means they don't have to spend them just on the bills. And they're being targeted by the cigarette companies as this is a good lifestyle choice, or this is something that it's cheap to do. And therefore, newly affluent people that have more money to spend on things that are not absolutely necessary in cigarettes, smoking has started to become an increased popularity. But it's also down to poor education. If you don't know the habits, just like when we're looking at those adverts from the 40s and the 50s, people didn't know exactly what the issues with smoking were, so they were more likely to do it. There's a cultural expectation as well in some countries, even in the past in the UK. At one point in time, it would have looked very, very weird if you weren't smoking, particularly if you were a man and you didn't smoke. You would have looked very strange. So there is a pressure from culture to smoke in some countries, or a gender expectation. Because you're a man, you must smoke. And there might be poor regulations. There might be nothing saying you can't advertise to kids. There might be something that says you can't say misleading things, so telling things that aren't true. The effects we should know. It leads to heart attacks, strokes and cancer from smoking. You're less likely to take part or less able to take part in sports because your lung capacity is reduced. If you smoke a lot, it might even stop you from working because you can't breathe properly. And it has a massive impact both personally, economically because you can't work as well, or to the NHS because in most cases this is cancer that they're trying to treat and it's very expensive. The cost of treatment means that most LICs probably won't be able to, people in LICs won't be able to afford it. And eventually you won't be able to work, and again you're going to lower the productivity and the wealth of that country if you've got a lot of smokers there. And as with everything, the death rate increases and your life expectancy is reduced. So what has happened, we've already started to discuss, particularly in HICs, health education programs. We know what the risks of smoking are. You're drilled in with that at a very early age in the UK. They've banned advertising for cigarettes entirely on TV and radio. Doesn't matter what time of the day it is, you can't advertise. They've raised the purchasing age. You can still smoke from 16, but you can't buy them until you're 18 in the UK. And they've also removed the cigarettes from view. You're behind a cabinet, and even the packaging is plain and it has those really horrendous images of what can happen if you smoke on the front of them. And finally, we have the development gap. So this links into everything that we've just been discussing. The development gap is the difference between the richer and the poorer countries. So on the presentation that I've got here, we have what's called the Brent line. This is an imaginary line that was thought up to try and split the world into two. The yellows represent the richer countries and the oranges represent the poorer countries. And we've been discussing how certain health issues are affected by whether there are richer or poorer countries. So the pattern of the development gap fits in very nicely with what we've been just looking at. So the Brandt line shows the general locations of HICs and LICs. However, there are anomalies, and it only shows richer and poorer as a distinct line. But in reality, there'll be countries that are getting to be a bit richer and maybe don't fit in that pattern anymore. And we can measure development in lots of different ways, which you can see here. So you could measure development by, can everybody read and write by the time that they're 17 to at least a primary school level? Because not everybody can, not every country that can. How long do people on average live for? The life expectancy. What is the percentage of people with access to clean water? The number of doctors per 1,000 people. So how many patients does each doctor have on average? How many children under the age of 5 die? And the GDP, so that's the gross domestic product. That's the money that the country earns from all the workers of that country. And then there are things like the percentage of children who are underweight between 0 and 5 years old. So we can measure development in lots of different ways. It doesn't just have to be about money. But how can we reduce the gap? How can we stop countries in, let's say, Africa from being worse off than countries in Europe? Well, a lot of it is to do with investment, so that's putting money into the country. That's done by governments like the UK giving money, or it could be through MNCs, multinational corporations. So, for example, Apple in the USA giving money to places in China or Pakistan or Bangladesh to make products, but also improve their area, their local area. We've already mentioned aid from charities and government to donate supplies and money. Technology, sustainable technology that's appropriate to the needs, the skills and the knowledge and the wealth of that country. So can you provide a bit of tech that is going to improve their lives, but it's not so beyond their understanding and knowledge to use? So, for example, donating tractors for local farmers to use to increase their crop yield. Debt relief. This is a big one at the minute where they're talking about how a lot of HICs have lent money to poorer countries but expect them to pay back installments every single month for a year. Well, the richer countries might not need that money, so why not just say, actually, we've given you that money, don't bother paying it back. That's debt relief. Fair trade, making sure that poorer countries and the people in there that are growing crops are paid a fair price for what they're selling. And then microfinancing, supporting small-scale projects directly from the banks to help poorer people. So they might have a little project they want to do in the community, and smaller banks or big banks in different countries might decide to fund that to help them get it off the ground. Well, that's it for today, but don't forget to complete the home study questions to test yourself as well. Goodbye.